Although many Idahoans struggle with opioid addiction, prescription painkillers play a major role in health care at the end of life. When patients enter hospice care, opioids are key to providing comfort in their final days and weeks. But as 6 on Your Side's Karen Lair reports, hospice employees are faced with a difficult situation after the patient passes. It's tonight's installment of Finding Hope.
Well, Don, in 2014, the DEA changed the rules around hospice, saying at the time of a patient's death, hospice employees are no longer able to dispose of those leftover medications. But that's something hospice workers from all over the country and right here in the Treasure Valley are trying to change.
Our whole goal in hospice is to keep the patient comfortable in their home, wherever that might be.
Comfort in the final days of a person's life often comes in a small orange bottle in some form of prescription painkiller.
Opioids are used on a daily basis.
It's a critical component in ensuring quality of life in those final hours, but when a patient passes, they leave behind leftover medication.
So what happens is those opioids are left with whoever is in the home.
Right now, hospice workers aren't allowed to dispose of prescriptions.
We can't physically touch the medications ourselves.
Instead, just educating family members on the best ways to take care of it.
Now, if the family says, I don't want to dispose of those medications right now, we leave. And then that opens up the possibility for diversion of those opioid medications.
The concern there is the pills make it into the hands of someone else, a younger relative or struggling addict.
It can go to other family members, it might go to neighbors. I mean, we've heard all kinds of stories of, people knowing that a patient was on hospice, maybe a neighbor, and they come in and suddenly medications end up missing.
But legislation circulating on Capitol Hill could change that. H.R. 5041, or the Safe Disposal of Unused Medications Act, would allow hospice employees to dispose of controlled substances left behind after the patient's death on site.
Our legislators were like, this is a no-brainer, it should pass, and so we're confident that they will support it once it comes up to vote.
It's a simple step toward the complicated solution of a growing epidemic impacting millions of Americans. So far, the bill is seeing the support of many lawmakers in D.C. and Evansville. There's a good chance it will pass. We reached out to Idaho's House members to ask them how they would vote on the change in law. And after reviewing the bill, Representative Mike Simpson's office confirmed he's now signed on to be a co-sponsor of the effort, adding his name to the list of lawmakers hoping to change the law and help hospice prevent opioid abuse. Reporting live in studio, I'm Karen Lair, 6 on Your Side.